Hi, this is Dr. Mark Vrahas. I'm the Levin Gordon Chair of Orthopedics at Cedars-Sinai and Professor of Orthopedics. You are listening to Interview with the Surgeon Agent.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Mark Vrahas, Chair of Orthopedic Surgery at Cedars-Sinai. Doc, how are we doing today?
Good.
Thank you for being with us. So, getting started, what were your goals and aspirations during your residency, and how did those change throughout your fellowship?
I'd say from very early on in the residency, I was interested in an academic career. I was interested in research and I was interested in teaching. And initially, I was focused on, I think my first love of the clinical aspects was hip surgery. Then I became very interested in acetabular fractures, which was a new field at the time. And then ultimately combined a career that was in joint reconstruction and trauma, and overall became more and more interested in trauma as I progressed through my career, especially in fellowship then. But always maintained a hip reconstructive practice as well as a trauma practice.
So kind of taking us through that fellowship year, what was your mentality heading into your first job search, and how that perspective changed the beginning years of your career?
Well, I think, the first question that a resident or a fellow always has to ask themselves is whether they want an academic career or a career in private practice. And there are private practice jobs where you have the opportunity to teach residents, and you can, if you're very dedicated, and some people do research in private practice. But on the whole, the environment of a private practice is not conducive to an academic career, just because everyone around you is not necessarily interested in research. Everyone around you isn't necessarily interested in teaching. Not that they're bad surgeons, not that they're not very dedicated to their patients. It's just not an interest of theirs. And part of the ability to be successful in academics is being around people who have a similar interest, a similar focus on teaching and research. Because ultimately in any academic career, we're not really paid at all to do the research or the teaching. That's something we do because we like it. So if you're not around other people who also like that, and that's not the goal of the practice, it's more difficult to achieve. So I think the first decision is really whether you want a true academic career or a private practice career that may have some ability to have interaction with residents and teaching, but it's generally not the same pathway. And if you're interested in an academic career, I always encourage people to take a true academic job at some academic center. And you may work at an academic center if you're in private practice, but again, it's more difficult to truly to maintain an academic career. In an academic center, your group, your academic group, your chairman, your institution are all interested in your academic success. If you're in a private practice, no one's really interested in your academic success. They're interested in what you contribute to the group in other ways. So it's difficult to really combine the two. Although people have done it successfully, it's much more difficult.
And so how was that process for you when you were going through the job interview before you decided to take that first job?
Well, my interest was in taking an academic job. So my job search was pretty much everywhere in the country. I wasn't tied to location. And if you want an academic career or even a private practice career, you're likely to find the best job by not limiting your geographic possibilities. That can be very hard for some people. people want to live where they want to live, but often those places are very, very saturated, and it's more difficult to start a practice there and build a practice. So I found it valuable to include basically the whole country in my job search when I started to look at jobs. You never know where there's going to be a job open that's going to be a good job, and not limiting your geographic search, it can be very helpful in that.
So thinking back, what would you say were some of the keys to your success that shaped your early career as you climbed the ranks of the academic world?
A supportive environment is the most important thing. So when you're looking for jobs, especially in the academic realm, money is probably the secondary issue. The primary issue is what kind of support are you going to get with your partners and in your institution? Is it going to be a good place to work? You can make all the money in the world, but if it's not a fun and interesting place to work, you're generally not happy. So my advice is always not focus on the actual dollars, but more on do you like and trust the people that you're going to take the job with, and is it going to be a supportive environment to work in?
Can you briefly take us through your journey and how you end up being the chair of the orthopedic program?
Yeah, I think that, one thing, I think it goes back to a bigger issue. I've always been interested in an academic career. I've actually liked every place I've worked. Every job that I've had, I've really liked. I've never left a job because I didn't like the job. I've always left the job because some other opportunity came up that seemed interesting. And that was basically how I ended up as chairman. I was very happy in Boston, where I was the chief of trauma, and I wasn't looking for jobs. I hadn't really, being a chairman was not one of my goals. I'm moving, I'm 62 now, so I'm moving towards the end of my career, and I was thinking about things that I might want to do. And as I got older and got away from really complex cases and really high clinical volume, I don't think you can do that till you're 70, and I wanted to be able to keep working, so I wanted to make some transition. I thought my transition would be towards health policy, and in that world, I had taken a master's in health delivery science and thought, I might sort of morph into that at some time. And I looked at the job at chairman here only because my son was at USC, and it was a free trip to visit my son. I was very happy in Boston. I was very happy with my job there. And I looked at this job, came out, and really liked the people. And I've always been intrigued. I tend to like to build things, and interesting challenges in building have been something that attract me. It attracted me from Penn State to LSU to build a big trauma center at Charity. I thought that would be an interesting task. And then when I was at LSU and was recruited to Harvard, I saw it as an opportunity to really make the trauma program at Harvard what it should be, and I took that job for that reason. And then when I came here to interview, I really liked the people, and it was a very interesting organizational challenge, which had a tremendous resources, both the people that were here and the heft of the institution. And I thought it could really be a special place with some organization. So I thought it was an interesting challenge to try to achieve that. And it also fit in with many of my health policy goals, because we were looking to change the direction of how we delivered care. So it seemed like a interesting and fun job.
Now, I know you touched on it before, but what advice do you have for the graduating chief residents and fellows entering the professional job market for the first time?
Well, there are a couple things I always tell the residents when they're asking about this, whether they're academic or non-academic. I tell them, never look at the first job as your last job. Most people, as you say, don't stay in their first job. So I always tell the residents to think of their job as a 2-year job. May turn into a 20-year job, but they don't need to try to ensure that they're going to be at a place for 20 years. I tell them to think in a 2-year thing, so that takes a lot of pressure off of what they're deciding. Second thing I tell people is, you can put a lot of things on paper, and a lot of advice residents will get will be, you got to make sure the paper is right and all the things are on it, which is true, especially if you're in private practice. But the reality is, doesn't matter what's on the paper. Ultimately, if you don't like the people and trust the people you work with, in the end, you're not going to litigate this stuff because it's just going to cost you more money than moving on. So it's much more important to really have a good gestalt of the people you're joining than it is to have things on paper. I think that's especially true in academics, because if you're joining a big institution, you're going to get a standard contract. There's going to be very little wiggle room around that. To be honest, for 20 years, I never even saw a contract. I never even looked at the contract, because what are you going to do? Am I going to sue Mass General? It's not going to make any sense. I mean, if you either are going to like working there and stay there, or just move on, go somewhere else. So I always, encourage people to look more at the people you're joining than the things on paper, because in the end, that's going to be a bigger determinant of whether you're happy in your job or not happy in your job than anything that's on paper.
So as we're dealing with the pandemic in 2020, now in 2021, what advice do you have for the graduating class regarding their networking and outreaching process in a virtual world?
They're better at it than me. That's what I have to say. I have no idea. I'm not an expert in networking in the virtual world. That's not how I came up through my career. So, it's a whole new world, which I have very little insight into. I'm not on Instagram. I'm not on Twitter. I'm not on Facebook. I'm on no social media. So I don't follow it. I don't know anything about it, and I don't know how to advise people about it.
So as a leader of the program, what are you looking for when you're interviewing medical students for resident spots and also residents for fellowship spots?
Well, ultimately, when we're looking here, obviously almost everybody applying these days is certainly capable intellectually for the job. So our biggest concern is culture. You need somebody who's going to fit into the culture of your place, somebody that's going to want to be in your culture, and somebody that's going to fit in your culture. So, that's very important to me, no matter if we're interviewing medical students for residency or residents for fellows or for people for staff positions. Ultimately, I believe the culture of a place is the most important aspect of how the place operates. So we're looking for people who will fit the culture. I would only say, I guess that if you're in a job, there's going to be good and bad in every job. And if And there are going to be many things you can't change, especially if you're at a big institution or a big practice. And we as surgeons like to be able to control things, but when you're in big institutions, there's a lot you can't control. And if you're in a big practice, there's a lot you can't control. And you have to decide at some point all the pluses and minuses, and you focus on the pluses. You change those minuses working within the system that you can. And if you can't, if the pluses ultimately don't outweigh the minuses, don't fight the system trying to beat your head against the wall. Just go somewhere else. If you think you're going to change the momentum of something that's huge, you're just going to be frustrated. So you're better off, focusing on the positive things. And as long as the positives outweigh the negatives, you're golden. And if they don't outweigh the negatives, as the positives don't outweigh the negatives, then it's time to look somewhere else.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.